Dr. Pamela Ruegg. I hold the David J. Ellis Chair in Large Animal Clinical Sciences at Michigan State University. And in this short video, we're going to summarize our 2024 Journal of Dairy Science Communications paper by Juliana Leite de Campos. In this study, we were looking at the economics of dry cow therapy, focusing on the selective versus blanket dry cow therapy, and not just the cow health, but the costs and the benefits of making a decision to use selective dry cow therapy. Now, dry cow therapy is a hot topic, and to understand the economics at dry-off, we analyzed records from 37 large dairy herds located in Wisconsin. The data in this study represented over 35,000 dry-off events. These herds are a snapshot of high-performing conventional dairies in the upper Midwest. On average, they managed about 1,350 lactating cows, and they had a high rolling herd average that was over 29,000 pounds. In general, these farms had excellent udder health with an average bulk tank cell count of 143,000 cells per mil, and the cows lived in free stalls, most using sand bedding. So this population is really critical to understand because it shows selective dry cow therapy can be applied to high-performing large herds, not just small farms. And it also shows which farm should consider it because you need to have already controlled milk quality and have good udder health. Now, historically, the industry standard at dry-off has been blanket dry cow therapy, which means we have typically recommended giving intramammary antibiotics to all quarters of all cows at dry-off. In this study, most herds actually used that strategy, and nearly 90% of the cows were dried off using both intramammary antibiotics and internal teat sealants. So in reality, the average partial direct cost just of the drugs was about $20 per dry cow, but the range was really wide. It went from $9 to $24 per dry cow. This is just the cost of the drugs at dry off. And that variation was based on really the cost of the drug that the producer selected. Farms that used higher cost drugs spent more than farms that used lower cost drugs. But remember, the sealants alone cost for about 36% of the total cost of the drugs, the antibiotic and the sealant, for most of these farms. Now, for appropriate herds, selective dry cow therapy is a more targeted approach. In our study, we used a simple algorithm to estimate which cows in this population of 35,000 cows could safely skip antibiotics and get only sealants. So our algorithm was that cows that had no history of clinical mastitis in their entire lactation and all monthly somatic cell count values under 200,000 were eligible to receive only sealants. And when we applied this algorithm, we found some significant savings were possible. 51% of all the cows in these 37 herds were eligible for sealants only. No antibiotics were required as they met the eligibility criteria. However, in some herds with outstanding milk quality, 93% of the cows were eligible to receive sealants only. Overall, about 50% of the cows in these herds, high-performing herds, were eligible for sealants only, meaning that we could reduce antibiotic usage. Now, beyond reducing antibiotics, we were interested in the practical impact on the bottom line. Switching to a selective dry cow therapy treatment protocol would save an average of just about over $5 per dry cow just in reducing drug purchases. For a 1,000-cow dairy, that's a savings of about $5,000 per year. We also determined that the best candidates for those savings were based on age. Younger cows have lower cell counts and fewer mastitis events. So 57% of first lactation animals were eligible to sealants only, but only 18% of third plus cows were eligible for sealant only. That means if you're going to implement this, you might want to start with just the first lactation cows who are drying off. All right, let's summarize. For herds that have controlled mastitis, moving to a selective dry cow therapy program can be a major step in antimicrobial stewardship. It's socially responsible. And while the financial savings per cow are modest, the cumulative reduction in antibiotic usage is large because our farms can reduce antibiotic dosages by up to 50%. Take-home message is really clear. If you've controlled contagious pathogens and have good management, selective dry cow therapy is both economically efficient and it's socially responsible. But always consult your veterinarian to review your records and determine if your farm is a good candidate to implement a selective dry cow therapy program. For more info, read the paper in Journal of Dairy Science Communications.